Now we've already discussed how important the muscular component of any injury is. When we look at that muscular component though, it's very specific and different from each person to the next. For example, if you're suffering from headache or neck pain, then obviously those muscles in that area are going to be primary to what we want to treat and improve upon. With Amanda's specific problem, she plays volleyball. In fact, she's an outside hitter, and so that places a lot of strain on the musculature of the shoulder. So specific to Amanda today, we're going to be treating her shoulder as part of our 1, 2, 3 process, the spinal adjustments, the extremity adjustments, and the muscle work. Now the shoulder in specific context to this is very complex and has many muscles involved. When we look at areas like perhaps the knee, the lower back, the mid-back, or the neck, there may be less muscles involved, but still that doesn't negate how important it is to properly treat and address that muscular component. Now, as with any kind of injury, the first step is identifying which muscles are actually injured. Now, with Amanda, the muscles of the shoulder girdle tend to work as a unit, and so we typically treat them all. We'll start off treating some of her shoulder muscles with a technique that's called active release technique. This is a form of massage, which is a soft tissue technique that's aimed at releasing and restoring natural movement within a joint and musculature around that joint. Now typically muscles should be able to contract, which they usually do quite well, but they should also be able to relax fully. And quite often what will happen is as we do menial tasks or perform in athletic events, we create minor injuries in those muscles. Injuries that sometimes heal with scar tissue. Similar to how your skin would scar up. That can occur in the muscles as well, and when it does, it restricts the normal motion and ability of that muscle to contract and relax. So it's very important for us to get rid of this scar tissue in order to restore normal ability in the muscle, as a first step then to later down the road be more effective in the rehabilitation process as we build the strength back in that muscle. As I often tell a lot of my patients, if you don't have proper function in a muscle, you can't really properly rehabilitate it. So sometimes when you start physical therapy or you're doing personal training or something and you're using a shoulder that's been injured, sometimes what you're doing is you're just reinforcing the bad muscular patterns that you have already in there. And then it can take someone like me a longer period of time to actually remove those bad patterns and get you to a state where those muscles are functioning properly, which we then start the rehabilitation process from there. In sort of short, it's usually necessary to tear things down before we build them back up. Now with Amanda, I've been working on the muscles in her shoulder, the deltoid muscles, the bicep muscles. We worked a little bit into the chest muscles. I'm now going to have her turn on her side, face that way, and we're going to work a little bit in the back of the shoulder girdle. You may see on Amanda's skin a little bit of redness. That's actually toxic byproducts being released from the muscle, and the blood flow is increasing in that area as well. So that's why you're seeing the redness in her skin. It's not me just giving her a friction burn, although sometimes it might feel like it. Very important that we work all over the shoulder, but unique to the shoulder is that we can typically treat one side without having to treat the other side, especially in a case like Amanda's where it's basically just an overuse injury. When you get into headaches, even if I've identified that most of your headaches are coming from the right side of your neck and the muscles on that side, it's always important to treat both sides of the musculature to restore balance. Now to finish off, Amanda's going to roll face forward. Face forward. Okay, both hands down. And we're going to work on the muscles in and around the shoulder blade. Amanda, I'm going to have you pull your elbow back like this, and then I'm going to have you go forward. Notice too how this muscle technique incorporates movement that Amanda would normally be doing in everyday life to actually stretch out these muscles while we massage them. Again, this is a form of therapy called active release technique. And the active component is just Amanda stretching out these muscles by contracting their opposite muscles through movement. And that allows me to get a deeper effect into the muscles. And it also allows me to work by stretching the muscles and work in the alignment of those muscles. Because every muscle runs in a particular fashion, whether it be up and down or left to right or kind of diagonal. And we get our best and most effective treatment when we work in the alignment of the muscle itself. And really reach. Good. And relax. Now, as a side note, whenever we're doing muscular therapy, it's always progressive. We can't just go to the worst area and the deepest area of the injury right off the bat. Normally what we have to do is we have to gradually build up and relax the muscles maybe on the outside, get those functioning more before we then go into the deeper muscles. This is where oftentimes when you have deep muscular therapy, it feels like you've just been bruised, and that's because a massage therapist, a chiropractor, possibly a physical therapist, or anyone else doing muscle work has just gone through those outermost muscles and tried to get to the deep ones. One other big difference is that instead of trying to go through those muscles, we work with them first, and as they relax, they allow us access to the deepermost muscles, which we can then release in sequence. I hope this has been informative for you today, and when you consider the fact of the spinal adjustments and the additive effect of the extremity adjustments on this, you start to get a complete picture of what actually occurs in the office with each patient on each individual day.